Recently, a client of mine who is a world record holder in powerlifting is having knee pain when they're doing sumo deadlifts. So in today's video, I want to share some therapies. We're going to be using some fun different tools on what we can do to address that knee pain. And it's actually specific to their adductor muscles being too tight. In the client's programming, we do have some mobility drills that we do at the beginning of the workout. We also have isolation strengthening exercises for their adductors. However, when we're pushing the limits of what we can do in our programming for both main lifts and accessories, we're going to run into maybe delayed recovery in specific weak areas. One of the things we can do is I have a tool that my dad and I made. It's just kind of like a metal bar that we bent, and it's kind of shaped to the thigh itself. You can do this with any other similar tool. One of the ways we can help alleviate some of that tightness is to drag an implement like this over top of a muscle that is having sliding or gliding type issues. So with this client, when they set up for their sumo deadlift, their adductor muscle, specifically their gracilis, is pulling on the knee itself, and they're not able to get a full external rotation where the outside muscles are balancing that tightness that's on the inside. So we want to alleviate some of this tightness. So we can take a tool like this and we would actually drag it across these muscles, and what that does is it loosens some of the myofascial tissue, and it can help the muscles slide and glide along each other better. Now this is more of a broad therapy, so you can see I'm hitting a lot of muscles rather than being very pinpointed to maybe the one that I exactly want. But this is a great kind of first level therapy that we can use. Now I can also do, of course, the other side as well. But this is something that's a nice quick thing you can do at the beginning of a workout before squats, deadlifts, or any type of exercise that involves external rotation with a stance wider than your shoulders. So this would be the first type of therapy that we can implement and see if it helps the issue. A second level of therapy that we can do is foam rolling specifically for the adductor and the groin. So I can set the foam roller down on the ground. I would want to get into like kind of a plank position where I have my weight on this thigh and the thigh is flared out. I'm going to be down on my elbows, and then I can kind of roll in and out on the area of the inner thigh that feels tight. So I can rotate my foot up and hit more, just a different area. I can rotate my foot down, that hits a different area. Once I find any spot that feels sensitive, I can pause on that spot and then actually extend and bend my leg, and that slides and glides some of the tissue underneath that pressure. And we can go down towards the knee, see if we find a spot down there, and again, play with my leg, kind of extend and bend the leg. I can also go up into the groin area, and I can come forward with my body weight, or I can go back and get that knee more of a higher exposure into that groin. So this would be the second layer of therapy we can do, is some foam rolling for the adductor area. The third option we have is definitely going to be the most pinpointed, also probably going to be the most painful, is using a lacrosse ball and doing a similar approach as what we would have done with the foam roller. What I'm looking to do now on my adductor muscles is you'll feel as you roll around with the lacrosse ball that we have the teardrop muscle, and there's kind of the inside edge here of where you would feel that you're dropping off of that muscle and starting to glide and slide and roll through other tissues. We also have our main adductor chunk, and then we have that gracilis, which is a small muscle that runs all the way from the groin to the knee. So what I'm going to do is use this lacrosse ball and try to find where I can find separations between those muscles. So I don't want to run through the belly of a single muscle. I actually want to kind of find the groove between two muscles. So I'm going to use the same approach as I did with the foam roller, but now on the lacrosse ball. So same position, I'm going to put the lacrosse ball down on the ground. I can start more towards my knee, and again, try to play with where I can find those grooves and crevices between the muscles. So right there, I found a good spot that's a little sensitive. So again, I'm going to do that bend and extend through the knee joint to make those tissues glide under the pressure that I'm creating on that lacrosse ball. Now I can slide all the way up, more into the groin. Again, I can play with bringing my body forward and see if that exposes a different area, which for me right now feels really good. So I'm letting my knee drop more, kind of that thigh become more parallel with my other thigh, as opposed to scooting back and having my knee be really up high towards my shoulders. So for me, this starts to hit more of the adductor, the chunky muscular bit, whereas when I come forward here, I can better separate the gracilis and find that groove between those muscles. So this is what I'll do, is kind of roll back and forth and try to find those crevices, those grooves between the muscles. Again, if you find a sensitive spot there, I'm just gonna bend and extend my knee. So now that I've done these therapies, I'm gonna be able to get into an externally rotated position for example, sumo deadlifts with this client, but it also can be any type of shoulder width or wider, externally rotated lift, whether that's a deadlift, a squat, Zercher, carrier squat or whatever, just whatever it might be, where if you get into that position and you find when you're externally rotating, if there's that pain on the inside of the knee, these 3 therapies will help a lot.